So today we have with us in the Mission Hospital Dr. Professor Sudhir Rawal, who is the father of robotic uro-oncology and uro-gynecological surgery in India. He has trained hundreds and hundreds of robotic surgeons all across the country. Namaste, Dr. Rawal. हाँ. सो आप बोलिए कि जो यूरो ऑन्कोलॉजिकल सर्जरीज आप चालू किए वे बैक इन द 1990s, तो वहाँ से लेके आज जो रोबोटिक यूरो ऑन्को सर्जरी आप कर रहे हैं, सो हाउ वाज द जर्नी?
Actually, I started uro-oncology in 1996, and I was the first uro-oncologist of the country in private. But if you see that I was the third or fourth uro-oncologist of India, because there were two uro-oncologists from Mumbai in TMS, Dr. Murli Kamath and Dr. Jagdish Kulkarni. I was the third one in North, and they were in a government setup, I was in private. And that was by serendipity, by chance, I landed in uro-oncology. Though I always wanted to do kidney transplant I wanted to be transplant surgeon. लेकिन ये हॉस्पिटल आ रहा था तो मेरे मेंटर थे डॉक्टर पांडे, तो उन्होंने मेरे से कहा, और मैं आई वाज वर्किंग इन गाजियाबाद इन हॉस्पिटल, so I came here, and after 2 months I realized that my destiny is in cancer, not in transplant. So, and I loved doing this big surgery, especially the radical prostatectomy, which was not very common operation in India, and even in England they were not doing. That time they were started picking up. We also started picking up. So in England and India, radical prostatectomy started together, and then I landed up in doing first radical prostatectomy in private in all over India. Otherwise, Dr. Hemal in AIMS and Jagdish Kulkarni in TMS, they did before me, and I never thought that the robot and all, it was not there at that time. Only thing I had that I was doing complicated surgery, giving good results, and slowly the laparoscopy started coming in field of oncology, which was not very well accepted, especially radical prostatectomy. Only 3 surgeons all over the world, like one in Germany, Rosweiler, other is Galliano in France, and Indigil in America. They were doing laparoscopic radical prostatectomy, one of the most difficult surgery, and then the outcomes were compromised because of the radical prostate. So suddenly the robot came because of the money man. He did first radical prostatectomy with Da Vinci, and after that most of the cancer surgery, especially in urology, partial nephrectomy, IVC thrombus, cystectomies, this switched over to robotic surgery. And I saw because in 2000, I think Manimanan did 2001, he presented his results in UCCon Jaipur. So I was really impressed, because laparoscopy also for me was not easy to pick up in a cancer center, because in cancer you have to have first tackle cancer rather than doing minimally invasive surgery.
But that's the primary aim.
Yeah, so we could not pick up laparoscopy much in Rajiv Gandhi, and then I got a young boy who did laparoscopic radical nephrectomy in our center, but then we got the robot, and by that time our volume of uro-oncology was quite good, especially prostate, bladder. So once I got the robots, and I was heading gynae oncology also, so I put all my uro-gynae oncology into the robot, like radical prostatectomy, cystectomy, partial nephrectomy, radical nephrectomy, inguinal block dissection, post-chemotherapy, RPLND, radical hysterectomy for cervix and endometrium. So this is how the journey actually evolved in uro-oncology or gynae oncology. And I have a lot of fellows in gynae uro coming and learning these things. So after me, there were many young uro-oncologists. They actually switched over to uro-oncology. Urologists, they switched over to uro-oncology. Many, they told me that because sir, you survive in private, so we thought we will be surviving all the private ones.
Exactly, with such a big man doing these surgeries in the
career in private. So young urologists, they thought, why not we can do, and they made everybody there is now the number of uro-oncologists so much that we had to create a society of genitourinary oncologist.
Fantastic. So there's a fairly long journey from 1996 to today, 2025, means almost 30 to 31 years, which is so amazing. So in this course of action, I think the first Da Vinci, that was the first robot that you used.
Yes.
That was Da Vinci X.
Da Vinci SIHD. That was my first robot in February 2011. There is an interesting story about that also, because my governing council chairman and medical director at that time, they were not very keen to get me the robot. So I threatened them that either you give me the robot, I'll leave.
So that's how you got your first robot. Fantastic.
SIHD was my first robot.
And then you got the X.
Then I got the X, then I got XI, and then switched over to also Mantra.
Yes. So that's the Indian, Make in India robot. But definitely, I think intuitive wise, the XI is.
Yeah, it's far better. And but having said that, we do many surgery with the Indian robot also, because it's make your program financially viable. You have to put a bit more effort in Mantra, and Da Vinci is fairly easy to use with is a users friendly. But Mantra is also evolving. Mantra is 2-3 years, is 25 years. So
and I think I met many surgeons at that conference who said that they are using only Mantra, and they are quite confident. In fact, in cardiac surgery, I saw somebody from Jaipur doing the surgery. He was very comfortable. I thought, yes. So, and you are using both.
I use both.
So you seamlessly switch from this to that.
I have.
Yeah, so you're probably one of the very few ones who very seamlessly switch from both the systems. Yes.